Hello, and welcome to Group 12's project, CoviTrends. The team members for CoviTrends are Albert, Alexander, and Benjamin. Our mission at CoviTrends is to provide statistics on COVID-19 cases, symptoms, and outcomes on a county-by-county basis throughout the United States. Our target audience are people who are concerned on where to travel to, doctors who made information on certain symptoms and demographics, and government officials determining which areas need aid the most. Features that users can expect include tracking on analytics such as symptoms, recoveries, deaths, total cases in each state or county, and more. The entity diagram showcases the relationships of an entity sets in our database. We have a total of 5 entities shown as boxes. These entities include county, hospital, cases, recovery, and deaths. Recovery and deaths are both weak entities. We have a total of 12 attributes, which also include 1 multi-value attribute and 1 derived attribute. The date of birth attribute is derived off the age attribute. There are 4 actions in our diagram. County has a 1 to n relationship with hospital through resides in. Hospital has a 1 to n relationship with cases through records. Cases has a 1 to 1 relationship with recovery through occurred from, and cases has a 1-to-1 relationship with deaths through linked to.
And from that ER diagram earlier, we were able to come up with the relational schema for our database. As you can see, each county is identified by these attributes. The hospital is identified by this attribute, and it has a foreign key for the county that hospital is in. Each case is also identified by a case number, and they have a foreign key for the hospital they belong to. And there are some additional relations to describe recoveries and the case they correspond to, the deaths and the case they correspond to, and one more relation to handle this multivariate attribute here, essentially the symptoms for each of the cases. And as you can see, it turns out it is very similar to the relational schema we had back in phase 2, only this time county ID is no longer the primary key of county, and recovery ID no longer is the primary key of recovery. And of course, all these foreign keys were adjusted. And for the normalization proofs, it turns out they were pretty easy, especially if we were working on this definition and considering that there weren't really any functional dependencies aside from the ones that involved the primary key. And so since none of the relations had any sort of non-trivial functional dependency that didn't involve a determinant as not a superkey, then all of the relations are in BCNF form. And of course, since all the relations are in BCNF form, the whole database is in BCNF form.
This is our front-end interface. Here you can see our logo and our company name, which is called CoviTrends. And you can also see the different pages that you can navigate to. Down here, we have our project overview. Here at CoviTrends, we are dedicated to maintaining a database application that tracks COVID-19 statistics in the United States, and it stores information about counties, hospitals, individual cases of COVID-19, recoveries, deaths, and reported symptoms. Below that, we have our project description, and we have our members here. So if we go to the state page, we can select the state to see its counties that have recorded COVID-19 cases and the number of COVID-19 cases recorded in that county since the start of 2021. So for example, if we select Washington State, we can see that we have 2 counties that have recorded COVID-19 cases since 2021 in our database. Those 2 are King and Yakima, and King has 1 recorded case and Yakima has 2 recorded cases. Going over to our county page, we can select the county to see the most frequent symptoms related to COVID-19 observed. And it lists all the counties in the US that's recorded in our database. in alphabetical order with respect to the state. So if we were to select Orange County, Florida, for example, we can see that there's 4 different symptoms that have been recorded in our database, and each have a frequency of 1. If we selected Yakima County, Washington, you can see it has 3 different symptoms recorded, and they all have a frequency of 1. Some counties don't have recorded symptoms, but they're still here because they have been recorded on our database. Going to the recoveries and deaths, we can see that there is a total of 10 recoveries and 10 deaths recorded on our database. We can see the breakdowns for recoveries and deaths. They're both categorized by age and frequency. So you can see all their ages on our database and the frequency of recoveries. And then the same thing for deaths, all the ages recorded on our databases and the frequency of deaths. Going over to hospitals, we can retrieve statistics for a hospital. We can select an area number. And when we first go into this page, we can see a table with counties with hospitals that have had multiple cases. So here are all the counties and their states that those counties reside in. We can select a county area code, and it also lists the county. And then this is also listed in alphabetical order according to state. So if we were to choose King County, we can see that one hospital has been recorded, which is the Harborview Medical Center, and it has 1 case. And then the table that we saw when we first went to the hospitals page, it's condensed to the right side. And then if we did Yakima County, we can see that this hospital has been recorded on our database and it has 2 recorded cases as well. So we've went over all the pages on our front-end interface, aka website. And this is a summary of all the things that it can do.
Well, now that you've seen the whole database application, we would like to end with a bit of a reflection. In particular, we would like to mention that the major challenge we had was coming up with some interesting queries and figuring how to use them for the site. But of course, the assignments in this course have helped out with that. And other than that, we thought of some ways to improve the overall user experience of the website if we were to work on it in the future. So, for example, we could have a feature where users can actually register their accounts and subscribe to email updates about things related to COVID-19, and also make the site a little easier to navigate, and also, of course, gather more information about COVID-19. And with that out of the way, I guess we're done.